Here in Arkansas, we continue to see record cases every day of the Omicron variant and COVID-19. Dr. Amanda Novak joins us live from Baptist Health with the very latest. I know you're very busy testing everyone right now. I want to begin with a common question about Omicron. The symptoms seem to be fairly mild in many, not in all. Why are we still seeing so many hospitalizations if that's the case?
Right. So I think there's two separate things going on. One is there are people still getting very sick with Omicron. They tend to be people that have underlying medical conditions, but I don't want anyone to think that Omicron is harmless or not doing any harm to people, because people are getting very sick with Omicron, especially if they have some underlying conditions. But there really is this other separate thing going on where there are people that are in the hospital for other reasons. Maybe they're in the hospital to have their baby or to have their gallbladder out or something like that. And Omicron is so prevalent right now. It's going around so much in the community that even some of these people that are in the hospital for different reasons test positive for Omicron. And that doesn't mean it's harmless. It's probably not helping their real reason for being in the hospital, but the COVID itself is not the reason they're being admitted.
And let's talk about monoclonal antibodies. I know it helps so many people over the summer and the fall, especially if they had the Delta variant. Can it help those with the Omicron variant?
Right. So it's a little tricky. We have 3 monoclonal antibodies that we've been working with throughout the pandemic, and only one of those has any activity against Omicron. So right off the bat, 2 of the 3 don't work. For people that do have Omicron and have other reasons that they would be at high risk of being hospitalized, so if they've never been vaccinated, if they have underlying medical conditions, then probably there's some benefit to them getting sotrovimab. That's the monoclonal that works against Omicron. Unfortunately, we just really don't have enough to go around. What we're seeing is that there are a smaller percent of people with Omicron are being hospitalized. And we really use those monoclonal antibodies to prevent hospitalization. And so even when we haven't had the supply, some people are still doing okay even without monoclonals.
Let's talk about the at-home test. If someone can get their hands on them, I've been looking all over town. These are a hot commodity if you can find them. If someone has an at-home test, if they test positive, do you recommend they go through and get a PCR test as well to confirm that positive?
So I think that's a great question. And most times through the pandemic, I would say, yeah, just to be sure, that's how we document it with the health department. That's how we do surveillance. Right now, there's such a crisis in testing and just in general that COVID is so prevalent. These lines for testing are so long. So right now, unless you need a PCR test for your employer or for some other specific reason, these home tests are accurate enough. If it's positive, then it's almost certainly a real positive, and it's really not necessary right now while we're in crisis mode to go then also get a PCR test.
That's good to know. A big kudos to your staff. Again, they have been amazing testing so many people. I know it's cold out there this week, but they have had such wonderful attitudes, and I'm telling you, you are all heroes truly on the front line.
Well, thank you.
Thank you so much. I know it's very busy, so we appreciate you for taking time for us again today. Dr. Novak live from Baptist Health.